know you work with many cancer patients and survivors, and at this time, and of course, I have to take it back to this topic because we predominantly work in
Yes,
oncology. I wanted to ask you, the cancer patients who are going through treatment right now, and those who have just come out of treatment and could
yes,
be classified as still high risk to a certain degree. There's a lot of panic in that space. They're worried that they're going to pick up the virus. They're worried of what the outcome of the virus can be on them.
yes,
There's a lot of fear, and
yes.
also there is also a lot of worry in terms of getting the medical treatment on time and them receiving whatever treatment they require. How does the cancer patient deal with this situation right now, and the caregivers as well?
Yes, yes. That's a very important point because cancer patients are vulnerable right now because of the immune system being compromised, right? Um, I would say that whatever it is that even under normal circumstances, battling cancer is very stressful. And now I think it's more so. It's much more stressful with the anxiety around catching an infection. So I think the first thing that cancer patients and the caregivers should do is to have a very clear communication with their healthcare providers,
Mhm.
like the oncologists, etc. About okay, what can we do? Is it okay? Is it okay to defer? Because for some patients it's okay for them to defer their treatment for some time,
Right.
but for some patients it is not. So I think instead of going into all the what ifs in their own mind, I think they need to seek clarity from the experts,
Mhm.
especially the healthcare providers.
Mhm.
I also tell cancer patients that they're already warriors, they already have the resources in them. So
Yes.
they need to draw on those same resources to handle this pandemic as well.
Mhm.
So one or two things I think which is important is whatever it is that they're doing regularly in terms of sensible diet and looking after their exercise a little bit, doing the meditation and the yoga. I think all those should continue because
Mhm.
that gives them a sense of being in control.
Yeah.
Because this pandemic is all about is stressful because people feel that they're losing control
Mhm.
and there's a lot of uncertainty, right?
Uncertainty. Yeah.
Yeah. And this kind of isolation robs people of three essential components of mental health, right? One is the sense of agency or autonomy that we have over our lives.
Mhm.
One is a sense of competency and productivity that we all yearn for. And the
Mhm.
other is a sense of connection. All these three important things are gone for most of us.
Yeah.
And for cancer patients, it's much more complicated than that because they have real worries as well
Mhm.
about the immune system. Also, it's important for them to focus on what they can control rather than what they can't control. Because the more we focus on what we can't control, we get into the negative spiral and we go into helplessness and anxiety, etc. So we always tell them to focus on, okay, what can I control? I can control my nutrition, I can look after my exercise, I can look after my own mental health.
Mhm.
Because stress is going to increase the levels of cortisol, and that's not good
Yeah.
for the immune system or for the cancer patients. The other thing is we also teach them to practice what we call radical acceptance.
Mhm.
That's a mindfulness technique
Mhm.
where you accept whatever emotions you have without judgment and with compassion, self compassion.
Mhm.
So it is normal to feel anxious. It's normal to have catastrophic thoughts. Accept whatever emotion comes up, whether it's anger, whether it's frustration, whether it's fear. Those are all normal emotions to have at this time. So once we accept all these emotions, we can contain them in a better way.
Okay.
And then accepting all these emotions helps us move into problem solving. And a problem solving approach helps us to be more in charge of our own lives and not feel so helpless, and maybe not feel grounded. So I
Mhm.
think that is important for people to practice